A lot of women want to know if there's any benefits to doing perineal massage before going into labor, like they want to know if it will reduce their chances of tearing. And the short answer is no. There's no benefit to it. What you have to think about is the fact that all of your pelvic floor muscles are like a basket weave of red rubber elastics, and the baby's head is like a bowling ball. So on your first baby, you have to push for 1 to 2 hours in most cases to help stretch all those tissues so the baby can fit through and be born. Just like if a bowling ball was sitting on top of a whole bunch of red rubber bands, it wouldn't start to slip through till all of the red rubber bands had stretched enough for it to come through. So that's exactly what's happening with your pelvic floor. All of the stretching happens when the head puts pressure on those tissues, and any perineal massage done before that point isn't going to change the fact that once the baby's head is putting pressure on the skin, it will start to tear. Really, your chances of tearing are lower if you have more elastic skin and higher if your skin isn't very elastic, so it has more to do with that. And the sheer fact that you have something this big coming out of something this big, something has to give. On average, about 80 to 85% of moms go home with stitches related to delivery, whether it be a tear or an episiotomy. And so there's lots of things that we can do for you after delivery to help reduce discomfort related to stitches. And the good news is those stitches dissolve and your doctor checks them out at your 6-week postpartum appointment. And most of the time it heals well and there's not any complications related to it. We have numbing spray, we have Tux pads, which are soothing to broken skin. We give you a spray bottle to help keep the area clean and reduce the risk of infection. And then also ice is beneficial for the first 24 hours to reduce swelling and kind of numb the area. So don't worry about it, there's lots of things that can be done. If you have more specific questions about it, ask your doctor. And if you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.